Hello and welcome to the Functionally Enlightened Podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Welcome back to the Functionally Enlightened Podcast. I'm your host, Dr. Sharon Surita, functional diagnostic nutrition practitioner and environmental toxicologist. And today we're joined by an incredible guest who is transforming how we think about healthy eating and chronic illness. Sally K. Horton, MPH, holds a nutrition degree from Cornell University and a master's in public health. Before becoming one of the world's leading experts in dietary oxalates, Sally had a distinguished career working in major medical schools and in medical education, as well as the public health research. But it was her own personal healing journey that ignited her passion for uncovering the hidden health effects or impacts of oxalates. And that research culminated in her groundbreaking book, Toxic Superfoods. I have it here, How Oxalate Overload is Making You Sick and How to Get Better. That was published in 2023 here. And we really hone in on all of the insights that she shares in this book, because where we work with our implant illness community, we see oxalates as having a deep impact in their healing. So in this episode, we'll dive deep into how foods we've long believed to be healthy, like spinach, almonds, sweet potatoes, how these can actually trigger inflammation, fatigue, pain, immune dysfunction even, and especially for those with chronic or implant-related illness. For many in our community navigating implant illness, Asia syndrome, or persistent inflammation, Sally's work offers a crucial missing piece. Sally, it is such a huge honor to have you here with us today. Welcome to the show.
Thank you. I'm so honored to connect with you and your audience, and so excited that you're seeing this piece. Missing pieces are powerful.
Yes, absolutely. So we'd like to start about looking at the hidden truth behind oxalates. For those who are new to the concept, what exactly is an oxalate and why are they a hidden problem in most of our modern day diets?
Well, oxalate is this sneaky chemical that nature makes. It's very easily made. It's a small, the parent compound is called oxalic acid. 2-carbon molecule, which is uber tiny with 4 oxygens on it, which is an interesting ratio and it's tiny, right? It's naturally degenerated. It's very easy to produce, and plants make it. A lot of plants make it. And it's one reason why many plants are not edible by us. People forget that you have to go to a special place called the produce department to eat plants. You can't just go out in your backyard and start eating plants and have that go well. Right. And it turns out that this is a hidden problem because the foods that we think are so healthy, as you said in your intro, can be laden with this oxalate just naturally. It's not like pesticides where it's a synthetic problem based on the way we're producing it. It's the way nature is. And people like me who've strived to eat well for a long time, since I was 5, it turned out that eating healthy was the very worst mistake of my life. And when I finally figured that out at age 48, that's what got me going. I can't be the only one. There's got to be more to this. That someone who is such a goody two-shoes, who doesn't smoke or do drugs or stay up late or do any bad things and eats perfectly, how could I have so many health problems? So oxalate is in plants, and people have to recall something they know deep down. You would never let children just randomly eat berries and leaves and things in the woods or on your bushes, right? Mm-hmm. And that's because plants have these chemical defenses that are quite toxic to animals, including us, because of course plants are in the way of beetles who are hungry and other insects who are hungry. If you remember the very hungry caterpillar from when you were 5, well, plants have to defend themselves against all of that. So we can overeat oxalic acid, which gets into our bloodstream. Oxalic acid does these crazy things. It grabs calcium. Calcium and oxalic acid like each other so much. That's the classic form in nature. So plants can use oxalic acid and build crystals made of calcium oxalate to protect themselves. They have these pointy crystals that look like toothpicks that are really designed as arrows to damage creatures that eat them. They make these blocks of oxalate they put in the bark of trees. Now, cinnamon is an example of a tree bark that we eat, and it has a lot of these crystals in it that helps keep beetles from boring into trees and so on. Really great for plants. Not so great for us to eat this acid. I'll tell you what the acid does, and eat the calcium oxalate crystals, both. You're getting both kinds of why we call them oxalates, is because oxalic acid grabs minerals and they're called salts, and that name oxalates refers to all these different forms that happen when an ion with a charge on it, which oxalic acid is, starts marrying and playing around with minerals. So you got this oxalic acid and these calcium oxalate crystals in foods you trust, like sweet potatoes, spinach, Swiss chard, beet greens, raspberries, chocolate, peanut butter, potatoes, some of the basic things you grow up on. I mean, we start giving kids potatoes and sweet potatoes and even a chocolate cake when they turn 1. And peanut butter now is being advised. The nuts and peanut butter are high oxalate foods. Physicians are advising parents to give children, young babies, peanut butter. These are all high oxalate foods. And this acid will get into your bloodstream really easily. It starts getting in there from the stomach. It goes right into your bloodstream and has immediate effects on the vascular walls, on the red blood cells, the white blood cells, damaging them. It can make you prone to infection, so on. It goes right to the liver. That's how the circulation works. Everything we absorb from our food goes straight to the liver. It uses up the antioxidant defenses of the liver. The glutathione is committed to protecting the liver itself, because people think, oh, well, a toxin goes to the liver detoxes it. No, the liver makes oxalate. The liver makes oxalic acid in its metabolism of amino acids. So when you're breaking down connective tissue, like the fascia and stuff that's supposed to be holding your abdomen together and keeping your pelvic floor up, as those tissues break down, they release these amino acids, particularly one hydroxyproline, that to a small degree is turned into oxalate. So the liver is making oxalate, not removing it. So the oxalate that comes in from your spinach salad pulls the glutathione resources from the liver, causes some stress there, and that amount of oxalic acid is increased as it flows from the liver up into the heart, then into the lungs, then back into the heart, and then through the body. So your critical organs, your liver, your heart, your lungs, and your vascular system are exposed to this after we eat foods high in oxalate, like chocolate, spinach smoothies, spinach salad, sweet potatoes, Swiss chard, nuts, keto bread, alternative breads for gluten-free dieting tend to have high oxalate ingredients in them.
Sally, that is so fascinating, especially that connective tissue piece, because as we know, people who are susceptible to hernias already have the collagen disorder. That's what makes them prone to this. Also, I've learned that people with pituitary tumors have this sort of oxalate imbalance too. So just over clinical practice, we see using tests like the organic acids test and just even general inflammatory response, these higher oxalate diets are corresponding with that super high inflammation and the inability of the microbiome to function as it's intended for the nutrient absorption. So you did mention a piece about the dietary oxalates contributing to system burden. And then there's the liver piece. So people maybe they're not consuming as much oxalates, but there might be that internal clock. Can you explain to us a little bit about maybe that detox pathway issue when the liver is actually producing the oxalates?
Yeah, so you've actually mentioned several things that I think are worth touching on. And I want to review them. We're talking about the liver and its ability to handle oxalate and create oxalate. Connective tissues. Well, it turns out that the Vulvar Pain Foundation, who is really the modern, who should be credited with our even having this conversation, because the Vulvar Pain Foundation came out 30 something years ago saying high oxalate diets are bad for women with pelvic pain. So pelvic issues, pain in the vulva and the scrotum and the genitals, the urinary tract, but the pelvic issues generally can be an oxalate problem. So she's been saying that for 30 years, and that's how I stumbled on it, is through her. what they discovered and what is very well confirmed in the literature, as far as I'm concerned, is that a high oxalate diet is connected to connective tissue disorders of all kinds, like fibromyalgia. I didn't even know what a connective, she's like, connective tissue disorders and all the descriptions, like, that's me. Is there such a thing? Yeah. So if you have thin skin and,
Mhm.
like you get bleeding cuticles and these kinds of connective tissue problems with loosey joints and stiff joints and joint issues and slip discs and pelvic floor weakness, all that stuff. Connective tissue weakness, Ehlers-Danlos syndrome, all that is very affiliated with oxalate poisoning. It turns out that oxalate creates an acidity in the body that breaks down collagen. So high acid in the body snaps collagen fibers in pieces.
Mhm.
Chop, 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 chop. So you have to keep rebuilding this collagen fiber and have it be functional collagen fibers that have the right length and strength and functionality. But what tends to happen is you get fibrotic, disorganized uh, fibers and tendons and other forms of connective tissue, and you get into trouble with now that you get dysfunctional problems with it too. So you get that stiffness and that functional limitation. But this weakness of connective tissue, oxalate probably is a major progenitor of that problem.
Mhm.
So just as a basic vulnerability, and then of course I think there's genetic things. In all cases, the way this toxicity, because we're talking about eating a poison, too much of it, too frequently, building up into a toxic burden that becomes a bioaccumulation problem. So it ends up sticking to tissues in the body that are damaged, inflamed, regenerating. So if a cell dies because it's old, or it dies because you just had a surgical cut, or you damaged it from hard work today, that dead tissue or necrotic or dying tissue is unable to defend itself. And when oxalic acid comes along, various units of calcium oxalate start coming together. It takes like 6 or 8 pairs and it starts to form a crystal.
Mhm.
Crystallizes out, just like the plants can use crystals. Pathogenically, we should not have these crystals in our body. Great for plants, very bad for us, but when you have dying and necrotic tissue, that's where it's going to accumulate, or where you have infections or inflammation. And when cells are regenerating because they're repairing from the death or the injury or whatever, that condition of those cells also makes them sticky to oxalate. So even if it's not the dead tissue because it can't defend itself, that new tissue that's developing is highly vulnerable to oxalate. So if you've had frostbite, surgery, any kind of injury, those areas, there will be oxalate accumulation. There'll be
Mhm.
crystals attached to that scar tissue and all of that. So you got oxalic acid helping to create a connective tissue problem that might get you into a surgical situation like a mesh implant. And then the mesh implant itself and that whole surgical process has attracted crystals in that area and
Mhm.
almost guarantees perpetual inflammatory response, because both the mesh and the crystals that are forming there are irritants to the immune system, and the immune system's job is to protect you from that. And it can just be perpetually irritating, like a little splinter in your foot all the time, and develop autoimmune problems. You also mentioned the microbiome. Apparently eating a lot of oxalate in your diet will cause dysbiosis. It also causes other problems with the gut where you get inflammatory gut disorders, and it probably promotes leaky gut, along with other plant toxins. Lectins are even better
Mhm.
at wrecking your gut. So if you eat a lot of beans and tomato seeds and skin and foods that are high in lectins, but the beans are the worst, you could cause problems with the gut that makes you more vulnerable to oxalic acid, and the amount that's going from your food into your bloodstream goes way up. So if you already have inflammatory bowel problems and you're eating just regular, not doing the spinach smoothie and the almond bread and the gluten-free diet, but you're just eating like occasional French fries and occasional mashed potatoes and like a more normal occasional cup of tea, you could still be what we call a hyperabsorber from that leaky gut, that inflammatory situation where the tight junctions aren't really working that well. And this stuff is just flowing in the water. And so you can be absorbing at 5 or 6 times higher than the normal rate and still get
Mhm.
into oxalate poisoning. So it doesn't require a consistently high oxalate diet to become oxalate poisoned. And if you've got a history of surgeries and issues, injuries, so on, frostbite, maybe from a ski trip or something, you probably have oxalate crystals there. And we know from the research that pretty much everybody has oxalate crystals in their thyroid gland, their
Mhm.
eyes, their bones and bone marrow, and their kidneys. Everybody. It's like by the time you're 50, you have an 85% chance of having visible oxalate crystals having developed in your thyroid gland. And
Yeah.
you mentioned, pituitary and these glands pick up oxalate, and oxalate can promote all kinds of problems, including this proliferative loss of control that ends up into both benign and maybe malignant tumors in
Right.
the body as well.
So it's more of a bioaccumulation effect happening, even if a person is not consuming a large amount, like you mentioned, genetically, maybe they're not able to break down any of the oxalates in the gut. Even with antibiotic use, we know that that ability is
Right.
reduced significantly. One thing that I want to touch
We
on,
could talk about that too, about the
yeah,
idea of breaking it down in the gut,
yes.
because your microbiome, the bacteria that can eat oxalate and break it down, because your liver can't do that. It's got to be the bacteria in the gut. It's way down in the colon, which is the far end of your digestive tract, right?
Mhm.
But you start absorbing oxalate, especially from tea and beet juice and that kind of, in the stomach. You get an effect within 15, 20 minutes. And within
Mhm.
40 minutes of a spinach smoothie, you have damaged your immune cells. Your circulating immune cells can no longer fight infection. But in 20 minutes, your colon has not begun to have a meal on that oxalate. So it's going to get into your bloodstream. What's happening down in the colon is the colon can be a site of excretion where we can take it back out of the bloodstream and put it into the colon. And the big crystals that you don't absorb, remember, there's multiple forms in the food. Some of it's that acid that gets in the blood. The crystals don't get into your body. They just irritate the digestive tract like ground up glass.
Mhm.
It's nasty grit that is inflammatory and abrasive and
Yes.
mechanically toxic to the gut, leading to the tendency to have inflammatory gut. But those crystals and any excreted oxalate coming back out of the bloodstream into the colon by the body, that's where the bacteria are helpful. And the studies talk about less oxalate in the urine because now the colon is working better to help the kidneys remove this oxalate from the body. There's a
Mhm.
lot of confusion about that. Yes, it's good to have a good microbiome. Can you figure out how to do that and can you just make it happen? No, you can't. A lot of us don't have these oxalate degrading bacteria, but even if you do, that doesn't prevent you from exposing your immune cells in your bloodstream to oxalate that's coming through your stomach, which
Mhm.
shouldn't have a high microbiome. You don't have oxalate degrading bacteria in the stomach. Those are anaerobic bacteria, and you need to have a healthy colon to have an anaerobic environment to begin with in the colon. A lot of people lose control of the anaerobic state that should be maintained in the colon because the cells of the colon aren't consuming oxygen at a fast enough rate to allow those anaerobic bacteria to thrive. So you can't just fix your microbiome if your gut cells are not healthy. They need to be healthy. They're the gardener that maintains which things will grow in your body. You're having a say back and forth with the bacteria about what's there. And if you're not healthy enough to do that work as a colon cell, then you can't just inoculate yourself and have it all work out.
Yeah, Sally, I want to go back the symptoms that you were mentioning, that glass-like sensation. That is one of the main symptoms that made me dive into your research when I found you. I had previously been on probably for about a year, a vegan diet in terms of celery juicing and smoothies with those greens in there, a lot of spinach. And I had been getting these flares, these horrid flares. And I would explain it exactly like you mentioned, glass-like pain, tearing sensation. And the doctors would look at me like I was crazy. You know, they did a colonoscopy, endoscopy, everything's good. But this continued to happen almost on a daily basis, this pain that would leave me bedbound. And I went on a ketogenic diet afterwards. And little by little, that started fading. And that's when I was like, well, what are the foods that I eliminated? It was all of those plant foods, those healthy plant foods. And I was consuming a lot more fat, grass-fed butter, butyric acid producers, things like that, and meat, animal products. And I realized I wasn't eating the beans. I wasn't eating those greens, a lot of the different, even the plant matter, the leafy greens, certain types of kale. I would be okay with one type, the dino kale, but I wouldn't be okay with another. And then I really dove into, in your book, you have all of those charts that are so helpful in trying to identify what is considered high, low, how to cook it. So it's not just a food list.
Yeah. Yeah. Oh my gosh. So, I mean, you can think back, like, why would you suspect your beans and your celery juice for your pain? Like, later on, you were able to see it, but it's
Mhm.
not a normal thought to have.
Right, right. It's definitely not, because you think you're getting all of the nutrients, the plant nutrients that the body needs and easy to absorb and assimilate, but it's not the case for everyone. And I would,
Not the case for most of us. And
yeah.
with most diseases, you can have a disease going around in the background and pretty much your body's faking its way through it because you got trillions of cells and they're all like rooting to win the day, and get you through the day. And so you can have a stage 4 or something or other and not know it until 6 months before you are terminal with a disease, right? You can have hypertension and not know it. So just because it's symptom free doesn't mean it's not going on.
Hmm.
And that's the dangerous assumption everyone makes. That stuff doesn't bother me. I don't care about that. Well, you want to care in the preventive stage because this is not something you do not want to fill up your tissues with particulate crystals all through your eyes, your thyroid glands, your brain, your bones, your critical organs, and your glands. You do not want to do this to yourself because once that silent disease pops through symptomatically and you realize what's going on and your body tries to reverse it, then you're in more danger than ever of having this autoimmune problem that becomes perpetual because you have filled yourself up with nasty little particles that shouldn't be in your tissues.
Absolutely. So this kind of plays into both toxins and toxicants because our body is producing as well as we're ingesting from the outside world. So we need to lower that stress burden all around. And so your book really talks about not only what to avoid, but it talks about what to do in essence, how to detoxify without causing Herx reactions. So can you talk to us a little bit more? We did discuss some of the symptoms. Can you talk to us a little bit more about some of the other symptoms that you primarily see? And then we'll get into how to address it.
Right. So there's symptoms before you know that you need to be oxalate aware and paying attention to oxalates. And then when you pay attention to oxalates and you bring them down so you're not eating such a toxic load, the body's now needs to do a clean out process. And this deaccumulation process might need to take a decade or might need to take a lifetime, depending on the depth and so on the process of your situation. So there's symptoms on both sides often. Before you know it, you could have sleepless nights. You could have intermittent problems with cognitive function, intermittent problems with mood and irritability or motivation, because there's a lot of neurotoxicity that goes with this. So
Mhm.
neurotoxicity can be also muscle knots and things, because what happens, oxalate grabs not just calcium, but it's causing inflammation around cells and cell membranes. They get leaky and they lose their potassium, and there's a whole lot of electrolyte disturbance. And you end up over time severely deficient in calcium and usually quite deficient in potassium. Most people don't eat enough of either one of them,
Mhm.
and other minerals. So there's these macro minerals, as we say, that you need in large amounts, which is calcium, number one, potassium, and magnesium. And then there's everything else, which is the micro minerals. All of those minerals are critical, super critical to how cells work, but none more important than calcium. Calcium is this intercellular signaler, and it's the calcium and potassium and sodium are so critical. That's the other macro mineral, are so critical to nerve function and muscle function. This is the nerves has to run electric signal down, and they do it by handling these little ions of calcium and so on back and forth, polarizing, depolarizing membranes is super happening super fast. In nanoseconds, there's all these little movements of ions. And when there's not enough of them, because you're deficient or because oxalate's in the cell or near the cell and is interfering with the cell's control of all of that, you put things in a mess. And with nerves, what usually happens is they're kind of stuck in this on position.
Mhm.
So the motor neurons can be activating muscles and causing things like hiccups and twitches and tremors and belching and bloating and just weird stuff with muscles of any kind. I used to get hiccups at bedtime after a day of eating oxalates, and often dinner had sweet potatoes and Swiss chard in it.
Oh,
So
wow.
4 hours later, going to bed, that's when you have the highest level of oxalate in your blood. You've had a whole day of loading up your bloodstream, and it takes from food goes from your mouth to the toilet in 24 hours. So it
Hmm.
takes about 8 hours or more of high oxalate after a meal. So by dinner time, I'm still high from breakfast and from lunch. And by bedtime, I'm elevated from all three meals because they're still there,
Hmm.
right? And they're still contributing to the oxalate load in the bloodstream. So at bedtime, you might have problems with mood, brain. For me, it was hiccups and belching and restless legs started happening. So nighttime things. And then you might wake up in the middle of the night to pee and have to run to the toilet because your poor bladder is too full of oxalates and doesn't like it and is trying to get rid of it. You can have frequent urination during the day as well. You could have this sort of micro urination where you're peeing out the tiniest amounts but have this urgency. So there's urinary tract stuff. So there's nerve stuff, there's urinary tract, there is the digestive system. If you got GERD or IBS or hemorrhoids or things like this or problems there, that can be oxalate related. And then there's the connective tissue. We talked a little bit about that, like arthritis and fascia problems and connective tissue problems. And you've got a tendency to inflammatory things, food reactions. And then when you go on this oxalate aware journey and you cut out the spinach smoothies and the almond bread and all these high oxalate foods, cut them down, the body's like, ah, and there's like probably layers of oxalate. There's the stuff you just ate last week and yesterday. Now you're eating lower. There's the stuff you've been eating for ages. And a lot of us get a rash within that first week of some kind. Or some people get what feels like a stomach bug.
Hmm.
Or they'll start getting headaches, or they'll be back to the toilet again, or that suddenly they'll get peace. Usually there's a minimum of a 3-day honeymoon period. Sometimes it's a 2-week honeymoon period. Sometimes it's a 3-year honeymoon period where you just kind of feel better. But then if you're like, yeah, I miss my sweet potatoes, and you go back and have the sweet potato again, if it's a small little, oh, guilty portion, you're like, hey, that didn't bother me. And you know why it doesn't bother you when you have just a little bit, when you're sort of, quote, cheating? There's no such thing as cheating in my mind, but we think of it that way. Oh, I really want a little sweet potato. Let's see if I can do it now. I've been real good for 3 months. And then it's like, hey, that's fine. Actually, I feel fine on that. I'm good with that. I'm going to start eating sweet potatoes because apparently the oxalate in sweet potatoes don't bother me, so I'm good. And then what's happening there is you're turning off the body's ability to get rid of it out of the tissue. And so you feel better. Because if you're full of poisonous crystals and your immune system is going after them, that's not an easy process to live through. It can make your symptoms worse. It's just like yesterday I got a bug bite having a picnic at night, right? And now today I'm itching like crazy. Or this morning it woke me up. I have this big red, itchy, burning thing on my body because yesterday I got bit. So it's not the bite that's causing those symptoms. It's your immune system's attempt to get rid of the damage and get rid of the toxin that was left behind by the bug. So it is the healing from the bite that's causing you discomfort and pain. And healing from oxalate crystals is similar to getting rid of a bug bite, but these bug bites are numerous all over your tissues internally. So you might start to feel a little worse as your body's healing from oxalates, and you put the oxalate back in, and that tells the body, oh, wait, we can't keep putting this back into the bloodstream, back into the kidneys right now, because hey, it's coming in from the bloodstream from outside. And so that signal of eating oxalates again can slow down that deaccumulation process, which is beneficial because you don't want the deaccumulation process to go real fast because you can literally poison yourself from within, and that's where
Hmm.
it gets tricky. So the symptoms then, skin rashes. I got eye styes after I changed the diet because it's coming out through the eye tissues. It seems to me that the cerebral spinal fluid and the brain tissues generally do seem to accumulate oxalate and do need to come out. And the eye tissues are is part of the brain. The eye is the front piece of the whole central nervous system.
Hmm.
And that's the most convenient exit route for junk collecting in your cerebral spinal fluid and your brain tissue. So you get eye symptoms. Sometimes you'll see grit in the eye secretions overnight, like pasted to your face. Have you ever seen that for yourself?
I've seen it in the past for sure, and I have heard it from many clients that they have a lot more. And in Spanish, we call it lagaña, and that's kind of the mucus that's coming out of the eyes, but it's gritty, like you said, sand-like.
Yeah, it's gritty. And so that could be the oxalate coming out and sort of drying. The same with the tartar on the teeth. When the blood levels get high, the saliva glands excrete a whole bunch more of oxalate into your saliva and it tends to form tartar. So when the tartar is forming heavily, that's a sign of high levels of oxalate in the blood, most
Mhm.
likely. I mean, there isn't good research on that, but that's the clinical observation that we see over and over again. People who have a high tartar problem before they recognize oxalates are an issue should recognize it as a risk factor. If you have crystally urine, which looks cloudy, or you have crystally saliva that's forming tartar on your teeth, that's a sign right there that you have too much oxalate in your body, whether you're pre or post awareness of it. It'd be nice if the dental world would recognize this because they can see it. If you go back to the dentist every 3 months for tartar removal, you need to be paying attention to this. So that's some outward signs will include the rash, the grit from the eyes, the tartar in the teeth, the cloudy urine. These are classic signs that your body's trying to shed oxalate because the crystals start forming in the urine and make it look kind of whitish, kind of opaque. So people should look at their urine when they're urinating.
Yeah,
Yeah.
now Sally, you did mention the tartar in the teeth, and this brings me to the biofilm topic. In the illness community, we always see that there's recurrent infections happening, whether it's vaginal mesh or even umbilical hernia mesh. It could be any kind of mesh, hiatal hernia mesh. Biofilms tend to be the main culprit behind those recurrent infections. And we approach it now with this knowledge always dietary first. We bring down the oxalate load slowly, and I'm sure we'll talk about that a little bit more, how to do that safely. But that's number one. Tier one is like look at the diet, adjust the diet before we start trying to break down those biofilms and then adjust the microbiome wherever that may be. So I did want to get your insights on biofilm on top of these crystalline structures, especially
Right,
in the site of surgeries that are like
right.
perpetual surgeries.
Well, that's kind of mid and late stream to that whole process of ending up with chronic infections. Oxalate undoubtedly causes chronic infections. If you have a history of like sinus infection, yeast infections, any of this stuff, and then this biofilm problem, with this is an oxalate problem because, like I mentioned very briefly before, we have to come back around because this is such an important topic. And I wrote a blog recently about infections and oxalate. There's a really nice study that was published around 2020 by the researchers at University of Birmingham. They gave 40 people a spinach smoothie and then measured their blood 40 minutes later and found that the circulating blood cells in over 70% of the people were no longer capable of fighting infection. The oxalate causes such damage to those circulating immune cells, they're putting out pro-inflammatory cytokines, raising inflammation, and incapable of fighting infection. So the biofilms will form because you have an incompetent immune system who can't control them in the early stages before the bacterial colonies are able to create these biofilms. So biofilms are evidence of a dysfunctional immune system who wasn't able to crop away these infections.
Mhm.
That's the number one problem. You give a child peanut butter every day and tater tots every day. They're going to be the kid who brings home every stinking illness from daycare and from preschool.
Yeah.
And that happens to us adults. I had a sinus infection every year, pretty much on the 30th of January, every year from age 17 to age 47. And then I went on this diet at age 48, and I haven't had a sinus infection in 12 years.
Wow.
Yeah.
That changed substantially all of the health, all of the
Yeah.
organ systems in the body. So, and you mentioned those foods, those are primary foods that young children are receiving, even in school lunch, which hopefully parents are now learning more and preparing more nutritious meals that don't include high oxalate. And we won't talk about glyphosates and just wheat in general, but that is
Yeah,
something that,
all of that.
yes.
It's really going to be our community reaching out and sharing it in a peer level like we're doing here, because the physicians and the pediatricians are being told by their organizations to encourage parents to give children these foods, plant-based foods, peanut allergies. They think now, back when I was in nutrition school, we avoided peanuts in children because of it. And now they're pushing peanuts on children, thinking that early exposure reduces the likelihood of peanut allergy. But what if there's so many other issues that are affecting children's immune function that makes us become these hypersensitive people? Having damage to your immune system with every meal will derange your immune system and set you to be vulnerable to infections, cancer, autoimmune disease.
Mm-hmm. Yes, and I see that now with my own children. I have two boys. One of them has, we'll say, dysregulated immune system. So we've been working with him. He's on a specific diet, but also I'm not sure if you ever see people with the mycotoxin and mold testing, but we can see the correlation between oxalic acid and mold species and mycotoxins. Can you talk to us a little bit about what you see with the connection between them?
Yes, yes. It's because of the dysbiosis oxalate causes and the acidity it causes. It gives these opportunistic infections the upper hand, and candida and other fungal infections get a whole opportunity. It's an environmental health problem. It's an environmental illness to ruin the landscape of your body with acidity and toxicity and an incompetent immune system. So you also have barrier function problems. So the connective tissue disorder means that the mucosal membrane that's lining your sinuses, your alimentary canal, your bladder, your various mucosal membranes through the body, the whole lung system, you have that barrier function between you and the outside world, which that line of cells is doing for you, damaged. Those tissues are not regenerating properly because of the effects on the cells causes a deficiency in energy. So the cells can't produce ATP like they should. So the maintenance of cell colonies, the ones that line everything, is poor. And so the barrier function is weakened, the immune system is weakened, the system goes acid, the connective tissue becomes more like scar tissue than healthy connective tissue. And you have this situation of acidity going on and mineral deficiency. So it's harder and harder to buffer that acidity. It's just a perfect storm for you becoming nothing but a petri dish where stuff can grow in you. And what I've seen with my clients is that long-standing fungal infections that do not respond to any treatment, they've tried everything, in fact, harm themselves by doing too much clay, which is full of heavy metals, and all these attempts to get rid of these infections has made the situation worse. Just going low oxalate and being patient about it, the body starts expelling these old infections. Now, obviously, you can use tools like enzymes and things to try to break down biofilms and give the body a little help. It's been surprising how many people came back to me and said, my fungal problems were all oxalate.
Yeah. Yeah, and they can track that too, not only symptom-wise. I'm sure you, as well as many other practitioners, there's always a tracking process. You don't know what you don't test or what you don't measure. So it's always the important piece of following a client through their healing journey. What's working, what's not, what systems need a little bit additional support. And with that being
It
said,
changes with time. You do have to just keep working the program for years.
right.
You have to keep tuning into the various situations, changeability. Yeah. And just one tool will work for a while, like a dietary change. You can change your macros around and get some real benefits. Say a no carb carnivore diet can be a very important washout, or even a vegan diet that's low oxalate can be an important metabolic washout. You can use all kinds of tools and supplements and so on. It doesn't mean you use that same tool like every day, so it is important to not think, well, okay, I got that handled, I'm done. It is important to continue to be learning and listening to your body, and asking yourself, probably something I'm doing is keeping me from having the energy I want, having the healing I want, or whatever. So, yeah.
Is there any reliable testing that you lean in on to get additional insights?
I have a real hard time with testing for several reasons. One of them is that we don't understand how the tests are skewed by oxalate. We don't have any data to know. We really don't know what we're getting with the test. For example, with oxalate tends to wreck these enzymes that run the energy system. So there's about 5 enzymes that are inhibited by oxalate. And one of the results of that is that you can have hypoglycemia when you're not eating and hyperglycemia after meals. So your blood sugar is all over the place and all dysregulated and can lead to prediabetes and diabetes and appetite problems because you're hypoglycemia, like, oh, I can hardly function. You got to eat something and you're eating. And so that's the test, like the A1C test. It just, how do you interpret that? You can't, because our tests aren't designed for that. Same with like even a urine test. It takes 9 tests to even guesstimate what your average oxalate level is in your urine, how much you are capable of excreting. You're not going to do 9 urine tests in a week or whatever. You just aren't going to do it. So the snapshot of these tests in itself is not showing this whole moving body. So oxalate is handled in the body in waves, circadian waves. They might even be in waves like at night. You go through various waves, 3 or 4 cycles of sleep overnight. So every 90 minutes, you're cycling through a little differently overnight and during the day and night. And then there's the annual cycles. I see oxalate accumulation go up often right before the winter solstice, equinox, moon, a whole moon, menstrual cycles. All of these things have effect on your metabolism. Day, night, you're going to do more deaccumulation of oxalate overnight because nighttime is when your body does healing and repair. Healing, repair, oh, we're going to get rid of some more oxalate. So you can't really always rely on tests because you don't know about all these cycles and the effects and what little moment in time. It's a still shot of a running race. Like you get one shot of a guy running by, but you really don't know the whole picture till you see in the movie. But we don't have continuous monitoring for most things. So we lack the continuous monitoring, we lack the understanding of the cycles, and we completely lack information about how a high oxalate diet or an oxalate deaccumulation process will alter these tests. And all the other things you're doing, all the other backflips you're doing with your lifestyle and your diet are going to influence tests. So it's very difficult to interpret tests. So I prefer to rely on deep interviewing, knowing the history of the condition, the history of the family, and knowing a lot about the personality and whether they're able to actually implement what we want them to do, and really relying on teaching them to stay in the conversation so they can keep learning with time. It's taken some of my clients a year to realize when I say take calcium, I really mean it. Like take calcium every day. Calcium is the most important therapy you can do because you are guaranteed to be calcium deficient. Calcium is the binder that removes oxalate from the body. Calcium lowers that acidity. Calcium soothes the nervous system and lowers the anxiety and just does so many things for you. And people have been afraid of calcium.
Exactly.
It doesn't compute for them that they need to take it 4 times a day. Take it at bedtime, take it in the morning, take it during the day. It is not only safe, it is critical for safe recovery from oxalate poisoning. And sometimes it's just people aren't able to implement that. So you can test all you want. If you don't know that someone's not actually doing what they need to do, what is the point of the testing? So I tend to actually downplay testing because I really need people to just really understand figure out together how we interpret the body, and we do experiments with, can we dose oxalate? Can we play with supplements? And can we, through the noise, through the art of paying attention, can we derive as much as we can from the test? Now, the tests are useful because they give us a lot of clues about, or hints about things we should be thinking about. But then and then a way to kind of see if we can see change over time. But we don't want to have the test be the main personality in the conversation of how do we heal.
Yes.
You know?
Otherwise, it would revert to that conventional standing where you see a lab marker elevated and you treat that lab marker.
Yeah. Treating a test almost never, ever works with oxalate poisoning.
Yeah.
But it gives you, as the provider, it gives you some clues about what might be going on with your metabolism or how, you have to use this kind of experiential and understanding what you can gain from the medical literature, combining all that, knowing the client, your experience with other clients, combining your understanding of the physiology, and then interpret the test and know the weakness of the test. Like EGFR. EGFR is a very unreliable test. It's heavily influenced by diet and age and other random factors that it's just a calculated ratio. I have found some people feel better when their EGFR is going down. And it's not the biggest concern in the room. And we expect to see that get better, but we have to be thinking about what dietary factors are affecting that and so on, and make sure that diet isn't like a carnivore diet will mess up your EGFR, that kind of thing.
Right,
Yeah.
right. So for our audience, and anyone who's suffering from chronic implant-related illness or any chronic disorder, what are some immediate steps? I know you mentioned the calcium. What are some other immediate steps that they can take to reduce the oxalate burden safely?
Right. So the safe is slow when it comes to toxins. Dose makes the poison in a toxicity disease. So you're harboring a buried, hidden toxic burden, and you don't want to disturb that too much too fast. You know, it's like if you're taking asbestos out of an old house, you don't want to just willy-nilly just have asbestos dust everywhere. And it's better to very carefully take a small area at a time and carefully encapsulate it and usher it out in a safe way. And that's sort of an analogy to have you understand that slower is better. So we try to not be, if you think you're having an oxalate clearing illness or one of these little crises illnesses where you get these clearing crises where the body is turned on with inflammation, that's causing symptoms, and it's dumped oxalic acid back into the bloodstream, which can cause hypocalcemia, which means not enough calcium in the bloodstream, which can cause arrhythmias, hypertension, and stroke-like symptoms. And literally, if you lose enough calcium in the bloodstream very quickly, you could have arrhythmia to the point that you have something called heart block.
Mm.
This is a known problem where people detoxing from oxalate or deaccumulating is more the correct word. They'll end up in the hospital with a pulse of 400, a blood pressure of 200, and they'll be like, and that's just an electrolyte crisis. They need potassium and calcium, and they need an alkalinity buffer. So using lemon juice is a great tool. I recommend people use 3 lemons a day because the citric acid is not only a alkaline buffer because certain percent of it becomes bicarbonate in the liver, but that citrate generally is important for kidney health. Citric acid loves calcium and helps to soften these calcium oxalate crystals. So it gets on the calcium oxalate crystal and turns it from something hard and glass-like, quartzy, to something more like chalk and much easier to break it down. So the lemon juice, very helpful because it helps with the acidity. There are enteric-coated alkaline tablets of basically baking soda that is in a tablet form that can help with this acidity. Minerals generally beyond the calcium can help. B vitamins, thiamine is very important
Yes.
because of the metabolism in the liver. So if you thiamine restore your energy production and protect you from overproducing oxalate, that can be in the new forms like TTFD, which is maybe not the right form. Sometimes you have to start people with benfotiamine and so on. So there's these tools with nutrients, very, very simple things used correctly. Lemon juice, baking soda, and calcium. Like it's almost like a home remedy, and yet it's very therapeutic and almost essential for safe recovery. You do not want to be in the emergency room.
No,
And
never.
then the other tool is like if you really feel terrible, go make a cup of black tea, which is high oxalate food, and that'll give you enough oxalate to tell the body to quit overdoing this. You're like way overdoing this, so calm down, and it helps soothe
Mhm.
it. And so we use oxalate as medicine now. You can use tea, beet juice, chocolate, rhubarb jam, which only takes like a teaspoon of it, small amounts of oxalate, but not too small. It has to be enough to have a metabolic effect. So we're using it as signal and we're trying to say very directly to the bloodstream in the body, stop with this excessive clearing of oxalate. Do not poison my bloodstream. Do not poison my kidneys. And normally it's trying to not do those things. But sometimes if you turn on systemic inflammation with cytokines all through the bloodstream, it lights up this immune system's ability to start going to town and get rid of this stuff. And you don't want to do that fast because it's really damaging.
Yeah, Sally, this conversation has been so insightful. I know our audience picked up a lot from it. I'm going to go back and rewatch myself and take some of these notes, especially with those tips to stop that dumping crises. That's something that not too many people are aware of. So I appreciate you sharing all of your knowledge with us, and do encourage everyone who wants to dive into it to pick up the book, Toxic Superfoods here. It does give you a lot of. Oh, yes, in different languages too. So our Spanish audience can also pick up a copy. Here you
Yeah,
go.
we have several other languages with French and so on, and German and Polish. And for those of you, especially people in a provider situation, you're going to want some data uh, about oxalate in the foods. And so I have a detailed data book only available on my website. There's a lot of scammy stuff on Amazon and other outlets. Only thing you can find from me online is Toxic Superfoods, the book in all the various languages. Anything else that has my name on it that's on Amazon is not mine,
Hmm.
not reliable, not credible. If you go to my website, you can get a cookbook there, and you can get the data book there, and that's it. So don't waste too much money buying copycat stuff that's not reliable, because there's some, it's just not quality, and it's
Right.
a lot of it's probably wrong.
Right, right. I'm glad you brought that up, because if you do just a Google search on oxalate foods, you'll see that there's different lists on every page you visit, but you need to go to a credible source. So thank you for bringing that to our attention as well. And Sally.
My blog has some articles about the data to help you understand why it's so wrong on the internet. And also my YouTube channel for people who want to hear stories of recoveries with, like, let's see, lipedema is another connective tissue disorder that affects women, that it may be an oxalate problem. We have a couple of stories of lipedema, a couple of stories of interstitial cystitis, which is
Yes.
another pelvic problem.
Mhm.
There are lots of stories that I think is relevant to your audience here. That's at SK Norton on YouTube.
Okay, perfect. We will put that in our show notes. And if they want to find out more or visit your website, can you share that information with us?
Yeah, my website is sallyknorton.com. Sallyknorton.com, just my name.
Okay. And one more time, the handles for YouTube.
YouTube is SK Norton, Sally K, just SK Norton, and same with Instagram, it's SK Norton at Instagram. There's another one for the book called Toxic Superfoods Oxalate Book, but if you find SK Norton on Instagram, you can find the other one from there.
Wonderful. All right. Sally, thank you again. Really appreciate everything you've shared. I always find this fascinating, and I know the people I work with can benefit 100% from everything you just shared with us.
Well, I am so pleased to be with you today, Dr. Sharon. I'm so glad that you're helping your clients. It's exciting. Thank you.
Thank you. And thank you to all of our audience. We'll see you on the next one. Take care.